More than 2.5 million people live in Cheshire and Merseyside, but many live in communities facing some of the highest levels of deprivation in the country. Here, cancer is often diagnosed later, and too many lives are lost too soon. Cheshire and Merseyside Cancer Alliance is working to change that. By improving early detection, we can help people get faster treatment, live longer, and reduce pressure on the NHS. Through our Community Partnerships programme, we're taking trusted NHS-approved cancer advice directly into local communities. Working with Council for Voluntary Services organisations, we've reached people who have been least engaged with healthcare. Together, we've built a network of social action leads called SALs, trusted local voices helping people recognise symptoms, take up screening, and take control of their health. Across the region, they're making a real difference.
We are proud to host the Social Action Leads. Social Action Leads work with communities in their patch and locality on a daily basis. This is a powerful movement that we're creating through this programme. To date, 48,000 interactions have taken place across communities in the region, reaching a real breadth and depth of our communities and wider society, with one clear message about catching cancer early.
So I got involved with Make It Happen because people were telling me about Amy and Make It Happen and what a wonderful place it was and a brilliant job they're doing.
So Make It Happen is a community shop on Market Street. So we provide pay-as-you-feel clothing for the community. People pay what they can. If they can't pay, they might give their time up. Also, we have a social supermarket within that shop, and we also are blessed to have a National Lottery funded space, and this runs activities for the community by the community.
What we've done is we've looked at how we could have the biggest impact for the communities that were coming in to make it happen. Very valuable conversations, people coming away saying, you know, I'm definitely going to go and look at this from a screening perspective. We played cancer awareness bingo here in this hub for a community of ladies, probably about 60 plus. And the person that won the bingo got a prize. It was one of our water bottles that we always love. And it was what the lady said to me. She turned around and said, I am so glad I've come today because I've learned so much about cancer. I was a bit afraid, I'm not afraid anymore. I've learned a lot, but also I won. and I had no one. Normally I'd stay at home and just cry, but I'm so glad. And I thought, wow, we've had such an impact on that lady. So Amy, with you being closer, you've probably got even more impacting stories.
Yeah, I think the highlight for me was that day when we met that gentleman who was a bit intoxicated the first time, but we went through some of the options that he had at his age around screening and being safe and stuff. And then sadly his friend passed away the following week because he didn't go for any checks and sadly passed away of cancer. But after that he realised the value of getting checks and utilised all the information that you gave him to go and engage with his GP.
So I'm Andrea and I'm the facilitator of the Speak Up For All group, and I've been involved with that group for about 3 years, which is a group of self-advocates who have got learning disabilities and autism.
So my name is Naomi. I've been involved Speak Up For All advocacy group for about 3 years now.
What do you think that's been the most important message for you? What's been the thing that has really stuck with you?
I got a bit embarrassed about getting Miss May done. So I think that's been the most important message, just knowing the signs. And if I didn't do all that, I wouldn't have gone.
Okay, so it gave you some confidence as talking about the screening and what was on offer, and then you did something about it, didn't you?
Yeah.
Yeah, which was really positive.
Trying to encourage more people in the community to make sure they get it done.
We get to talk with people about things that might be a barrier to them in terms of screening and in terms of the early detection of cancer. We get to have really informal conversations that can actually make a really big difference.
We went over to the GPs on Bath Street and we all went up there and everybody was allowed to sort of ask questions and stuff, and they showed us the machines Some people hadn't done it before. There was a few of us who had screening done, but we wanted to make sure the others felt more happy to do it. I then had a breast screening done, and I went to get my eyes tested. I had a bowel screening done, had blood pressure checked, I had an ECG to check my heart was all right. I think it's good for people to be talking about cancer. If they're really not very well and they start talking about it, I think it brings them out of a crisis, really.
Bridge End Centre is the heart of Bollington. It's a community space where anyone can come anytime during our opening hours. We've got no waiting lists. There's always someone here to talk to if they need it. We also run a range of different activities to go alongside that. We're a really good place for people to come and just get information and to educate people in a really gentle, light touch way. I do a lot of awareness, so articles in our newsletter, social media posts. We've created like a bit of an information hub about cancer, how to reduce your chances of it occurring, what to do if you're worried about something, a change in your body. And the funding is also paying for some exercise classes and guided walks, which kind of give us an opportunity to talk to people about cancer and just being aware of it.
Bridge End isn't what it is by accident or by luck. It's there because of the hard work put in from the top down through the staff team. There's a very relaxed but professional. Somehow there's a good balance, which I think people feel secure with, they feel comfortable with, and they come here to be in a safe place.
We've got quite a few different stories. One of my main stories is for Breast Cancer Awareness Month. I wrote an article and put it in our newsletter, put it on social media, so it went everywhere. And quite a lot of people have said to me that they actually went and got screened. And then a lady actually came up to me and said, I've got a lump on my breast, what do you think I should do? So I was like, well, go to the doctor. So yeah, quite a few examples through that.
The Community Partnership Programme has been amazingly successful at reaching members of our population who the NHS hasn't reached before with cancer awareness messaging. Through more than 200 projects, the programme has really made a big impact working through our CVS partners and grassroots organisations, faith organisations, and that really is creating a real traction around improving early diagnosis for our communities. In 2019, Cheshire and Merseyside was significantly below the national rates for early diagnosis. That has now changed. Cheshire and Merseyside is now significantly above the England average, and just in the last year that has equated to 2,500 years of life saved and £7.8 million saved for the NHS.
I'm incredibly proud of this programme. It's transformational. It's a testament to cross-sector working. It's a testament to innovation and thinking differently about how we share messages with our communities. I believe this programme is, through those 48,000 interactions and many more to come, leaving a lasting community-led legacy across the region.